Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Melissa Schiffman. She is an internal medicine physician, and she wrote the Kevin MD article, Primary Care. I love the variety and the intimacy of the problems that are placed before me. And that's a story from the book, Becoming Doctors 25 Years Later, 25 Physicians Sharing the Journey from Medical Student to Retirement. Melissa, welcome to the show.
Hi, thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
So today I am a primary care internist outside of Philadelphia. I see mostly geriatric patients. I did my training at Emory University in Atlanta, and then at University of Pennsylvania for residency.
Wonderful. And I'm an internal medicine primary care physician myself, so I'm certainly looking forward to speaking about the virtues of primary care. Now, in your practice, you said that you see primarily geriatric patients. So tell me some of the challenges and rewards of your practice.
So I'm relatively new to this field, and to be honest, I chose this job mostly for work-life balance, which is important, but I've really come to enjoy the geriatric patients. I think one of the challenges is just so many people come to our practice and say they feel like they weren't listened to, that they were not taken seriously after being a certain age. I think there is a lot of age discrimination, and it really is a joy and a pleasure to develop relationships with these patients and to see their value and the value of the lives that they're living.
So give us a sense of the types of patients that you see. What do they come to see you with? Give us a case study of some typical patients that you would see on a typical day.
Oh, I mean, it could be anything. And that's what is so fun about primary care is, it could be a little thing, it could be a big thing. So a lot of times we do get a lot of patients that are new to Medicare and may not have had a physician for years or had any health insurance for years. So it's not uncommon that a new patient visit turns out to be a pretty dire diagnosis or something that's been ignored, which is always really, gratifying to be able to help patients that have been waiting for so many years to get their heart condition treated or their emphysema under control. Or it could just be, the little day-to-day, I'm stressed, I'm lonely, I have a cold. So many of the conditions of geriatrics are embarrassing for patients to talk about, the incontinence, the memory issues. And I think it's so important for them to have a safe space to feel heard and to be able to connect with someone about those challenges.
Give us a sense of the clinician access when it comes to geriatric care in your area. Is there a shortage, or how difficult is it for a geriatric patient to see primary care?
I think there's a shortage. It's pretty incredible that we're in Philadelphia, which has such a wealth of medical services, but it's very difficult to find a primary care practice that is taking new patients. A lot of our local practices, the local independent practices have closed. I think a lot of physicians have retired over the COVID year. So we do have a lot of patients that come to us saying that their doctor that they had a long relationship is no longer practicing. They've had a hard time finding someone.
Are you seeing new physicians or newly graduated residents go into your field?
I think it's a challenge. I think, I love primary care, but I think there also is so many unfortunate downsides to the logistics of primary care these days that I do think there are not enough providers going into it. I am learning in recent years to work more with nurse practitioners and other team members to help extend our care. And I think that is going to be really important going forward.
All right, let's talk about the Kevin MD article that you wrote. It's titled Primary Care. I love the variety and intimacy of the problems that are placed before me. And that's from the book, Becoming Doctors 25 Years Later, 25 Physicians Sharing the Journey from Medical Student to Retirement. So for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
So 25 plus years ago, I was published in the original anthology, Becoming Doctors. where medical students all over the country submitted stories and essays and artwork about being a medical student. I submitted a very whimsical story about a cadaver in an anatomy lab that turned out to be a vampire. When I was invited to write a 25-year update, I was not going to write about vampires anymore, but I was inspired to think about corpse pose and yoga and just that moment of the day where you're kind of getting your energy together, getting ready to face your day, and all of the things you need to do, whether it's in the clinic with your family. And I really just wanted to provide a slice of life of, what goes on in someone's mind as they're getting ready for their day.
One of the common themes on this podcast, on my blog, of course, is clinician burnout. And I'm sure that everyone here is familiar with the numbers of almost 50% of physicians say that they are burned out. Now, tell me about some of the rewards of your profession. I always want to take a more positive slant when it comes to primary care. Tell me about some of the rewards of primary care. What drives you and what brings you to work every day?
I really think the best thing is the stories of the patients, and writing this story, reminded me of that I used to write creatively as, a college student and medical student. And I think one of the things that drew me to primary care was the access to patient stories, and the layers of getting to know them through the years. I think it really is such a rewarding relationship on both sides. I'll tell my patients, just something off the top of my head. Oh, my son's learning to ride a bike. And they'll come back 6 months later and say, hey, did your son learn to ride the bike? I think it really is just a privilege to be part of their mental space. And I certainly, have many patients that are just an important part of my mental headspace as well.
One of the things that you mentioned earlier about why you went into the field was work-life balance. So talk more about that.
It's a challenge for all of us. There's never enough time in the day. And, even parents who don't work outside the home don't have enough time in the day. Plus, you're adding a whole other job to that. I think it's definitely doable and rewarding, but you're going to do things a little different than a parent who does not have another job outside of the home.
So talk about some of those challenges that you're describing and how did you overcome them?
First of all, I think if you're fortunate to have a partner, pick a good one who's going to partner with you. I'm fortunate to have a husband who is very involved with the day-to-day workings of the family. I think it's important to have, whatever supports you need, whether it's, in my case, before or after school care, whether it's cleaning service, whether it's just saying you're not going to be able to do everything. Think about what's important to you. I think a lot of times we get wrapped up in, doing things because we think we need to do them, making the perfect cupcakes for school or attending every single event. I think it's really important to, soul search and think, what's important to you and your family. Don't worry about who's judging you, and do the things that are going to be meaningful, and don't do the things that aren't meaningful to you.
One of the things that I also think contributes to the success of primary care rewards is the practice itself, whether it's properly supported, whether administration is on the side of the physician. So talk about your practice, about how it has contributed to your joy of primary care.
It's interesting because I actually had changed practices between writing the story and the time it was published. So the new practice I'm in definitely has more supports as far as, nurse backup, as far as, structure for things like answering phone calls and refilling medicines and things like that. I think one thing as primary care doctors, we're often kind of like the final dumping ground of stuff no one else wants to do. So, I can't get in touch with my eye doctor. Can you fill my glaucoma drops? Can you write my return to work note for the shoulder surgery I had? And you want to help. I think most of us go into this because we care about our patients and we want to help them. But it's just not sustainable to do everything for everyone else. So it's important to, be able to ask for help where you have it. And I really wish as a system as a whole, there was more of a integrated way for all of us to work together as a team instead of, the specialists are kind of pushing and pulling with the primary care. No, you do this. No, you do this.
We're talking to Melissa Schiffman. She is an internal medicine physician, and she wrote the Kevin MD article, Primary Care. I love the variety and intimacy of the problems that are placed before me. Melissa, if you were talking hypothetically to a group of medical students and you wanted to tell them about primary care and why they should go into that, what would you tell them?
I just think it's, again, it's about the patients. It's about the longitudinality of it, getting to know people over time. At this point, I've been in clinical practice for over 20 years, and I have patients that I've known, for most of that time. Many of them have followed me to my new practice. And there really just is such a special bond and relationship and ability to help people. It's very different if you, go to an urgent care and get an antibiotic for your bladder infection, as opposed to coming to a physician that you've known for 5 or 10 years and can really just catch up on so many things in that visit. So I really believe that it's important and an essential part of our medical system.
If you were to do this journey all over again, is there anything that you do differently?
I think it's just important to take time to reflect and think about where you are and what you want. Writing the story gave me a chance to, step back and see where things were. I don't know that I would have done things differently, but I think it's easy to get caught up in the day to day. So take time to think about why you're doing it, to appreciate the rewards of the career you've chosen.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
My take-home message is breathe. Take a pause, enjoy where you are, really feel good about the benefits you have for patients' lives. I think what we do as primary care physicians is so important. So give yourself a pat on the back and enjoy it.
Melissa, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you very much.